Hello, my name is Gary Carson. I'm a student physical therapist assistant at CBD College. Today, I'll be presenting a case study on my patient who is experiencing an unspecified low back pain and a cervicalgia. In this presentation, I'll discuss his condition, examination findings, interventions, and my reflection on this case. Let's start with an overview of the patient condition. Patient's low back pain and cervicalgia are primarily due to physical strain and were significantly aggravated by two recent motor vehicle accidents, unfortunately. Low back pain is a globally prevalent condition affecting up to 80% of people at some point in their lives, and cervicalgia, or in other words, neck pain, is also common, especially with advancing age. These conditions are particularly common among adults aged 50 and older, and those with a history of trauma or repetitive strain. There are both modifiable and non-modifiable risk factors for these conditions. Modifiable risk factors include poor posture and physical inactivity, which can be adjusted through therapy and lifestyle changes. Non-modifiable factors include age, as spine degeneration is more common in older adults, and a genetic predisposition, which makes some people naturally more susceptible to a condition like disc degeneration and musculoskeletal pain. Now let's look at the pathophysiology. In a healthy state, the spine supports body movement and protects the spinal cord. With cervicalgia, strain or compression in the cervical spine can cause pain and limit range of motion. Low back pain is often due to disc degeneration, which can lead to nerve compression and biomechanical imbalance. This pathophysiology affects patient's body in three main ways. He experiences migraine, headaches, pain and inflammation in his back, uh, and his mobility is significantly reduced due to muscle spasm and tightness. Patient reports pain level reaching 10 out of 10, which intensifies with movement. He has limited range of motion in his neck and lower back, and there's a muscle tightness, especially in his upper trapezius. His posture is affected, showing a forward head position, which is typically in cases of chronic cervicalgia and low back pain. This pain and reduced mobility impact his daily function in several ways. He has difficulty walking, standing for long periods, turning his head, and reaching overhead. In physical therapy, our goals focus on addressing these functional deficits by improving his mobility, managing pain, and enhancing strength to help him regain daily activity participations again. During his physical therapy evaluation, we performed range of motion and manual muscle testing to assess his movement and strength. Special tests included the reverse Sperling test, which was positive, indicating cervical radiculopathy. Based on these findings, patient prognosis is good with continued therapy, although recent setbacks from his accidents make steady improvement essential. In the acute phase, research supports the use of pain management techniques such as cryotherapy, gentle cervical traction, and STM, which stands for soft tissue mobilization. These interventions help reduce immediate pain and elevate muscle tightness. As he progressed to subacute phase, interventions shift to therapeutic exercises for flexibility, neuromuscular re-education for posture improvement, and manual therapy techniques for further enhanced joint mobility. These interventions are designed to address both pain and functional limitations more actively. In the chronic phase, we focus on restoring function through training activities that promote core stability and posture reconnection. We incorporate cupping therapy to increase the blood circulation and progressive strengthening exercises for the spine and extremities to support his ability to engage in daily activities without any pain. In the clinical setting, two key interventions we used were soft tissue mobilization and upper trapezius stretching to relieve muscle tightness, and the Theragun for relaxing his upper and lower back. Both interventions aim to reduce pain and improve relaxation, allowing him greater mobility during session. This case has emphasized the importance of a holistic, multimodal approach to managing pain and improving function. If I encountered a similar patient in the future, I would definitely prioritize early intervention and perhaps coordinate with pain management specialists to ensure thorough care. The literature provides valuable guidelines on addressing both acute and chronic stages of pain and musculoskeletal issues, and I plan to stay updated with evolving evidence to enhance my therapeutic approach. Thank you very much for your attention. This concludes my presentation on my patient's case. I'm happy to answer any questions or discuss any points further. Thank you very much again, and you have a really nice day. Bye bye.